So we just finished up with our June buyout. We did another eval on one of the horses today, so we are officially done with our full evaluations on everybody. We did not have Dr. Lydia this time. She was out this week, so it was just Dr. Gina and I. It was Dr. Gina's last buyout. It went very smooth. It was pretty calm this time after the initial triage. We did it over 2 days just because we did have a lot of horses and a lot of them that were pretty sick. So we will start with our first horse, B25-125. She was the one that was down on the trailer as soon as they arrived in the first trailer, kind of right towards the end. We did an initial assessment of her kind of on the trailer and then got her off, and she had a 5 out of 6 heart murmur. Her heart rate was extremely elevated. It was at 120, which is unbelievably high for a horse. She had no upper incisors left. Her body, whether it was from a mix of being down on the trailer and or from beforehand, she was covered in wounds. A lot of the horses, there were quite a few that were right near her that when trying to get off the trailer were stepping on her, so some of them were fresh wounds. She wasn't making any attempts at all to get up. And so we very quickly gave her some pain medication and then provided her with the last act of kindness.
Poor girl. B25-126, who we know today is called Theos. He was the one that we just triple checked today. He was another horse that was down on the trailer. He's a big draft boy. He was on the second trailer, and Tawny was able to get him up after hosing him down and really encouraging him and getting him some water. So her supportive care really helped him have enough energy to get up. And he is separated out in the round pen by himself, but on the day of intake, he had a temperature of 102.8. He had a heart rate of 76, which is pretty elevated, and a high respiratory rate of 40. He had a lot of effort when he was breathing, and so we just kind of really quickly gave him electrolytes. We gave him Torb, which is butorphanol, a pretty heavy pain med. We also gave him Banamine, which is an NSAID for pain. Did a CBC chem on him that day, and he had really high white counts, white blood cells, leukocytes, neutrophils. He had lower than normal red blood cells. And he had a few changes on his chemistry that looked like muscle damage from being down and kicking in a trailer. We rechecked his blood work today. His white counts are a little better, but they're still elevated. His red counts have gotten worse, and his chemistry has changed in other ways. Some things got better, and some things are still looking like inflammation. We took some radiographs of him, and his shoulder on his right side does have changes. His whole right limb pretty much has changes all the way down. And he's pretty painful on it, so he did not want to let us do much on his left side as far as like getting his foot up on a block and things like that, because he doesn't want to bear weight on his right side. So we still have concerns about him. His heart rate is staying pretty high. His temperature has come down, but even on pain meds, he's still acting pretty painful. So we're not quite sure, quality of life-wise, if we'll be able to control his pain and help him feel better, but we are trying everything we can think of that's within our wheelhouse here. But so right now we still have him, but we'll just say he's guarded right now. We're not quite sure which way he's going to go, but we're trying our best with him.
He's a very sweet boy.
He is a good boy, though.
B25-127 was a paint stallion. We don't have a lot on his exam because he had a severe club hoof in the left front foot and was in both hind legs, had DSLD, and his left front was so bad that you could tell he was extremely painful just trying to walk around. And immediately got pain medication. For those of you that have not watched one of these before, if we don't say they got pain medication, we mention that they are painful. They did get pain medication. Most of these horses did. It just gets very repetitive telling you guys that. So we did do radiographs of that foot after we provided him with the last act of kindness. We didn't want to make him stand on that foot any longer than he needed. And there were a lot of serious changes in that foot. Yeah, he was having a very hard time.
All right. B25-128 was a 11-year-old Belgian draft gelding boy. He was beautiful with red roan. He also had an elevated heart rate of 52, elevated respiratory rate of 40. He had increased inspiratory noises. So when we say that, we mean when we listen with our stethoscope to their heart and lungs, especially their lungs, when we say they have increased noises, it means like abnormal noises that shouldn't be there. He was blind in his right eye, and then the biggest thing for him was that he had a right front fetlock abnormality, so he was over at the fetlock, so instead of it being in its normal position, it was over, so his weight bearing was off, and he was very painful and lame in that limb. He was another one that immediately got pain meds, and we knew right away that there was no way to help control that pain, because even with that pain med that we gave him, he was still very painful. So he also received the last act of kindness, and they took radiographs afterwards, and that joint was significantly abnormal with super proliferative bony changes. So unless he had orthopedic surgery with as big as he was, would not really have been very good for him. So there would have been a difficult time maintaining his quality of life. So
B25-129, 20-year-old quarter horse gelding chestnut. He had some short, shallow breaths. His respiratory rate was 64. A little bit of decreased mobility in his jaw. He had a mass at the top of his tail, a couple abrasions, and then both front hoofs were deformed, and the left front was pretty painful. You could tell when he was walking around that one specifically was causing a lot of discomfort. Received pain meds, and looked like a chronic founder horse. Had the very typical hooves of that and everything. And so we did provide him with the last act of kindness as well.
yeah. We did take radiographs of him afterwards. That was, we kind of had to divide and conquer a little bit, and he did have severe rotation, and the tips of his coffin bones were starting to deteriorate. So yeah, he was, and we were hoping that the pain meds would have helped him, but he got worse and worse and worse, and he did not want to move. So he was definitely entering into a laminitic crisis the day he came, and then it just progressively got worse. So he's one we got on top of really quickly. B25-130 was an 18-year-old gelding splash paint. He was very kind of QAR, which means quiet alert responsive. He was kind of depressed, but he would respond whenever you would talk to him and touch him. His temperature and pulse were fine. His respiratory rate was a little elevated at 34. He had increased effort with his respirations and increased noises in all areas of his lungs. He had some old wounds around his eye and forehead, some sunburns, but his left hind was very swollen, especially at the fetlock, and there were 2 draining tracts on either side. So he was barely wanting to put weight on that. And so we knew that it most likely involved the joint. Even with pain meds, he was very, very painful. So he was given the last act of kindness, and he was one of the ones that Tawny took radiographs of afterwards, and it definitely had gone through the joint, and so that drainage was coming from within the joint space. So he was definitely very, very painful, and I'm glad that we didn't have to keep pushing him through that.
B25-131, 2.5-year-old paint stallion. Oh, this little guy. He had his right hip was either dislocated or it was broken. Was barely putting any weight on that back right leg. There was a complete shift in, if you looked at his hips from behind, the one was way lower. Gave him pretty strong pain meds right off the bat because of how uncomfortable he was. He wasn't moving around a lot. He also had increased lung sounds and wheezes. And we did provide him with the last act of kindness early on in the day, just because he was very uncomfortable, and with a broken or dislocated hip, there wasn't going to be anything we could do for him. So,
Unfortunately, a lot of these are very sad.
got a lot of rough horses in this time.
Yeah, a lot of them had a lot of scrapes, bumps. A lot of them have respiratory diseases.
Yeah, we had a lot in this group with copious amounts of nasal discharge.
Yeah, so if you hear us repeating it over and over and over again, I'm sorry, but we're just kind of giving you what we found on everybody as we get to their papers. But pretty much everybody had some varying degree of respiratory infection, unfortunately, and they were so scraped up. It's very, very sad. B25-132 was a 2-year-old standard bred gelding. Beautiful black horse with a little star on a sock. He's a little nibbly. He loved to give nibbles, but he wasn't mean. He had a fusion in both of his hind legs, and his right front toed out at the fetlock, and he had a very deformed foot. So if you watched, they got footage of him walking, and his right front was just like way out here, and his whole foot was deformed. So we gave him pain management, but based on the degree and severity of his deformity, he was given the last act of kindness, and radiographs afterwards showed that even within the hoof capsule itself, his bone was also deformed. So there wouldn't have been anything we could have done surgically to repair that here. He was cute though.
Yeah. B25-133, a quarter horse mare who was 18. She was a bay. Overall, she just looked like she felt terrible. Increased inspiratory lung sounds. She was missing a tooth. She had ventral edema in her armpit, in her right suspensory. She had abrasions all over her. She also had poor conformation in both of her fronts. And then she failed her neurologic tests multiple times. And so whether it was some type of paresis in the hind end, but she looked off at a walk, and when we pulled the tail to the side, she failed that on several accounts. So she was provided with the last act of kindness.
Yeah, she just looked in general. She didn't look.
Yeah.
B25-134 was a 28-year-old quarter horse mare. She was pretty thin. She had a normal heart rate, but she did have a left systolic heart murmur, a 3 out of 6, which is one of the lowest heart murmurs you can hear, as far as like 3 out of 6, 4 out of 6, 5 out of 6, that kind of thing. She was possibly a cribber because her incisors had a lot of problems with them that look like what a typical cribber looks like. She had a fusion in her left hind hock, a small mass on her chest. She also failed her proprioceptive placing test multiple times. So we have some testing gone out for her to see if she has any kind of neurologic disease that we need to worry about that's communicable to other horses like EHV1. But we haven't gotten those results back yet. But just based on all of the things that we found all at once, all the comorbidities, she was feeling pretty bad. So last act of kindness was the best thing we could do for her.
B25-135 is another 20-year-old quarter horse mare, chestnut. She was down in the trailer. I don't remember if she was on the first or second trailer. I think she might be the one that got up on her own in the trailer. She does have a 3 out of 6 murmur as well. She had a lot of nasal discharge. She was coughing, covered in abrasions, again, mostly from being down on the trailer. Has a fusion in her right hind fetlock, and she was a little bit lame in that right hind leg as well. She also has enlarged masses right where her thyroid sits. And then she was given pain meds. We did x-rays on her. She's the one with the kissing spine, right? She has pretty significant kissing spine and a little bit of pain on palpation of that area. But we have her out in our quarantine pastures right now. We're going to give her some time to kind of settle. And when Dr. Lydia gets back, we're going to have her kind of reassess that pain in her back and see if maybe some of it was just from being down in the trailer or if it is because of her kissing spine, and go from there. But right now she's just kind of decompressing out there.
B25-136 was a 4.5-year-old spotted saddle horse mare. She was really super cute. She was blind in both eyes and had ocular discharge, some nasal discharge, multiple scrapes, scraps, bruises. But she was really off in the hind end, even just watching her walk around. So she was one that we didn't really have to collaborate on. Tawny looked at her, looked at me, and she was like, this one looks really bad, and I agreed. So she was given the last act of kindness because she was just very bad in the hind end. Which is sad because she was so young.
B25-137, 1-year-old Tennessee walking horse stallion. He was also blind in both eyes. We had several fully blind horses this time.
Very ill adjusted.
Yeah, he was not well adjusted at all. Was very fearful. And so we provided him with the last act of kindness. He was another one we didn't get super in-depth into his full exam and everything just because we knew how scared he was of being there, and that with being not well adjusted and fully blind, that wasn't going to be a great outcome for him or quality of life.
B25-138 was a 12-year-old spotted saddle gelding. He had a really high heart rate. It was 68. But his lungs sounded just fine. He had abrasions all over his face. His right hind was abducted and away from his body, and he had a lot of atrophy in his right hind, and he was lame at a walk. He was a big, beautiful horse, though, but you could tell looking at his back right leg that it had been going on for a while, and even when he walked, it kind of gave out a little bit on him. So I don't think we took any radiographs of him, but just the severity of his lameness and how abnormal that right hind was, he was given the last act of kindness, but we did submit samples for him just to also make sure he didn't have anything like EHV1 that would be communicable to other horses.
B25-139. He is a 17-year-old standard bred gelding, a cute little brown boy. He's so sweet. He has a couple little health concerns, some kissing spine, some bony proliferation, but didn't have any pain on palpation. He was slightly dehydrated. He was placing his hind legs a little bit weird. We rechecked his neuro exam, and he seemed okay. He has cataracts in both eyes, but is visual. Slight increased respiratory noises, but we gave him the night to kind of see how he did. So he was when we looked at Tuesday, and then Wednesday when we went back up to do additional horses, he looked a lot better. He'd had hay and water all night, some time to decompress after the trailer ride, and was less weak in his hind end than the day before. And so we have him down for a dental. He needs some tooth work, and we'll kind of recheck some radiographs and his neuro exam in a few weeks. But he's really sweet, and so far we have really high hopes for him because he's a really good boy.
Yeah, he's so cute. He's a little bit like a protector. Whenever you or Sydney would go in the pen to get other horses, he would kind of be like, leave them alone. They're my friends. It was really, really, he'd turn and look at you and put his ears up like, did I do good? He's so cute. Oh, I like him a lot. B25-140 was a 3-year-old grade mare. She wasn't handled at all. She didn't want to go in the squeeze chute. She just kind of went back and forth, back and forth, back and forth, and then she'd freeze. And she'd just sit there and she'd just shut down. But Other than that, she had a pretty significant hernia on her ventral midline. It was probably about this long of a defect in her abdominal wall, and if you could palpate the pooch, you could feel bladder, and you could also feel loops of intestine in there. And she would just stand out in the little pins with everybody with her ears to the side. And those horses, when they do that, that kind of shows general malaise or discomfort. Like she just looked like she felt really bad. So getting GI contents entrapped in hernias is a pretty significant problem. You can repair hernias if you catch them soon enough. It's really easy on younger like foals as opposed to adult horses because there's a lot of pressure. So if you ever hear about colic surgeries, like any kind of laceration or surgical cut, there's a lot of pressure from the internal organs on that, especially on the ventral midline, and it takes a lot of wrapping and securing to make sure that they don't eviscerate themselves. So that can be a pretty complicated surgery in adult horses just because of the location and the pressure and everything. But she had a lot of changes in her lungs. She had crackles. She was coughing. She had a lot of mucopurulent pudding nasal discharge, which we swabbed and sent off to see what it was. But just because of how uncomfortable she was and the significance of her hernia and her blood work didn't look very good, based on all those things together, she was given last active kindness.
Yeah, she was when we went back and forth on quite a bit. We had reevaluated her the second day again, because once we had gotten her in our chute system, it seemed like she had calmed down, but then when we really looked at her, it was more of the freeze. It wasn't that she was relaxed and comfortable, and it was just like she was terrified. And instead of fighting us, she just froze and let us do stuff. But yeah, she did not feel good. And we kind of debated being able to tackle that surgery was something we could try, but for her quality of life and the amount we were going to have to handle her and make sure it was healing right and keep her stalled up, it wasn't going to be a good quality of life for trying to get through that surgery with how complicated it was going to be in an adult horse. So, B25-141 was a little paint pony, 12 years old, stallion, black and white. Had increased respiratory noises and some slight wheezes on the right side. Was long in the tooth and had club hoofs bilaterally in both hind legs, and they rotated out pretty bad and appeared to be a little bit neurologic in the hind as well. And just with those abnormalities in the back legs like that, and we did provide him with the last act of kindness.
Yeah, I think he was in there with those two blind horses. Mm-hmm. Yeah, he was very off in the back, poor guy. B25-142 was a 2-year-old grade mare. She was black with no markings. She also had a hernia, so she was either the baby of or the sister of the other mare that we had because they were in the exact same location and they both had the exact same build and color markings and everything like that. So we think they were probably related because it can be hereditary in animals. She did not feel very good either. She had a temperature of 102.4. She had really harsh sounding lungs. She had cuts everywhere. She had a really gnarly one actually on the inside of one of her back legs that we didn't see until the second day. Mm-hmm. That was looking pretty rough. She had swelling on her right side of her trapezius muscle, which lies just right over the shoulder blade. And it was only on the right side. It wasn't on the left side, but it was really firm and kind of warm. So I don't know if she had a penetrating wound or if there was some kind of myositis or something going on there, but that was just something of note. And her left hind leg was also abnormally shaped, and she had a deformed hoof just enough that her whole leg was rotated away from her body. So usually in animals, especially horses that have deformed limbs, that usually happens sometime after birth or right before birth, and then they kind of, it's a congenital problem. And if you don't catch it early and fix it, as they grow, it just gets more and more painful and more defective to the whole musculoskeletal system. So seeing that she had already had that degree of change in her left hind leg as young as she was, with the hernia and her lungs and fever, and her blood work also looked pretty terrible. She was given last act of kindness. Sorry, it's not a very fun one this time, guys.
Oh, this guy. B25-143 was a paint stallion. He was 18, brown and white. He was one that looked pretty stable on Tuesday. And so we were planning to evaluate him on Wednesday. I am one of the first people that gets to work in the morning, and especially during buyouts, if we still have horses up at our intake barn, I always make sure to look up there, make sure nobody's down, nothing happened. And unfortunately, I did see a horse down. It ended up being him. He clearly had been struggling for quite some time. He was kind of towards the end of a stall and had one leg through a gate. Was not breathing well, could not stand up. And so another staff member luckily showed up right then. Gina was about to come down and help me, and we provided him with the last act of kindness. But rough way to start the day, and unfortunate for him that he had gone down and had looked pretty stable the day before. So
Yeah, unfortunately, that happens sometimes with our buyout horses. They go through such a stressful event being trailered and brought. Yeah. And a lot of these guys are really underweight and emaciated, and it was so hot when they came. They were all sweating. So we tried to give everybody electrolyte supportive care, pain management, but sometimes once they kind of, then they just kind of go down and they can't get back up. So that's happened to us a few times, unfortunately. I didn't know. B25-144 was a 12-year-old stallion paint, brown and white. He had a really nice personality.
he was so good.
He was a very good boy. He had terrible sounding lungs, wheezes, coughing, just horrible, like coughing almost nonstop. He had horrible nasal discharge, eye discharge. He had difficulty breathing. He had a laceration actually above his left eye. He had a fusion in his distal fetlock, so we were like, let's take a radiograph of that, because if he has an infection that we can handle, great. We'll give him antibiotics and treat him through it. But he was off in the left hind, and that one was also pretty swollen. So we took a radiograph, and he had what looked like fragments or proliferation right in the suspensory apparatus. And so with that location in the suspensory, or the flexors, and the swelling and the painfulness, even after giving him pain meds, that would probably have to have been something that had to have been surgically removed. But he was not in any way, shape, or form a surgical candidate at this moment because of how sick he was otherwise. He also had a BB pellet in his withers, we found. So why people shoot horses with BBs, I have no idea. Or any animal, for that matter, with BBs, I will never understand. But he also had areas of kissing spine that had pain associated with them. The fragments in his flexors with the swelling and lameness. So given all those things, and he was just so miserable, we gave him the last act of kindness. But he was a real good boy.
Yeah, he was another one that we really
We debated.
We're like, well, what if?
Yeah.
But the reality was, it would just, with needing multiple surgeries, and
he was already
he was
and sick. So.
really sick. Oh, he was such a good boy.
He was.
B25-145, 13-year-old quarter horse gelding. He was a bay. He fell coming into the barn when we were shifting him in. It can get a little slippery out there with that many horses, with the poop and the urine and everything, but he wasn't even really going very fast, so it was kind of odd that he fell coming in. He had a 4 out of 6 heart murmur, increased respiratory rate and effort, also had increased noises, so his lungs weren't doing great. Had a lot of ocular discharge and conjunctivitis. He had a really big abrasion all on his right hip. it didn't look super fresh, like it wasn't from the trailer, but it covered like his whole hip, and was just trembling the whole time in his back legs, and his right hind fetlock was swollen, but his hind end just was trembling the entire time he was standing there. Overall, just seemed very depressed. Stood with his head down the whole time. You could tell he just didn't feel good. And so we provided him with the last act of kindness.
I get a living one. B25-146 is an approximately 8-month-old little filly. She's really cute, quite spicy, but almost in the best of ways. Like, she's spicy when it's appropriate to be spicy, and then she's good when she needs to be good. She's a little wiggly, but so I couldn't really listen to her lungs too well, but her heart sounded good. So she has a little abrasion with some, it looks like something just kind of like sliced off the top layer of skin, and it's kind of hanging on over there, but it's old. So we took radiographs of her front fetlocks, and there's some changes, but it's very minimal on radiographs. So really the best thing for her now would be to ultrasound it and see if there's any damage that we can't pick up in the soft tissues with the radiographs. But she's sound on all 4 limbs. So we gave her all of her vaccines, and she's out with the really good boy from earlier that likes to protect us. And I think her name now is June, the older 20-year-old chestnut mare. Yep. So she's out in the pasture with them. So hopefully she gets to go to our training events and adoption. She's super cute.
Yeah. B25-147 is a 2-year-old quarter horse, a bay with no markings. We're not completely sure if he has been castrated, not yet. We couldn't fully palpate. He was trying to bite quite a few times. He was being a little spicy, and wasn't great for his pokes, but overall, he looked pretty good. He had a temperature, so we only ended up giving him his rabies vaccine, not all of his vaccines. But for the most part, we're hoping that with a little bit of training, and we'll double check to see if he does need to be castrated or not, but he looks pretty good.
And the next guy, B25-148, we think is maybe related to him. They look very similar. He's also 2. He is not castrated. We could find 1 testicle on him. Hopefully we can easily find the other one, because we can't do cryptorchid surgeries here on horses, that you have to go into the abdominal cavity and get the other one out. So it's a pretty major surgery that we can't really do here, because you need the whole full sterile surgical room with intubation and all that kind of capabilities that we don't have. So he is with the other 2-year-old boy in a pasture, and hopefully when Dr. Lydia is back, because I won't be here, they can get him up and verify that he, yes, indeed does have his second testicle. He would not let me palpate, and he would not go in the chute. So in order to not break my arm, I was just like, okay, we'll call it even, and we'll check you later. So he did not have a fever, so he got all of his vaccines, and he is out in the pasture, and hopefully will be castrated and go through the adoptions. Yep. And I think he was the last one we looked at. So, yep. So we have a few hopefuls. Most of them are pretty young, so that's good.
Yeah, the three young ones should hopefully make it to adoption. Not really too many concerns with them.
Yep.
Typical buyout. A lot of sick horses that are super sweet and ended up in the wrong situation.
Yeah, but I'm glad we got them, so we could at least give them some pain meds and give them a shot, and then if they couldn't have a good quality of life, then we were able to give them a nice dignified passing. So it's the name of the game.
Yeah.
Fortunately, that's it.
Yep.